Diagnosis: 12-year-old girl presents a clinic with history of recurrent oral ulcers and prolonged bleeding after minor injuries. Lab findings reveal a normal platelet count, prolonged bleeding time, and large platelets on peripheral blood smear. Further testing shows impaired platelet aggregation in response to I'm not sure how to say that, but normal aggregation in response to ADP, collagen, and thrombin. Okay. My first gut here, recurrent oral ulcers and bleeding. Okay, prolonged normal platelet count. So it's not a quantitative, it's a qualitative. So I'm down to like Glanzman, Bernard Soulier, and von Willebrand. Impaired platelet aggregation. So I know Glanzman is, I think that's 2B, 3A. I'm pretty sure Bernard Soulier is like 1. It's like, I know it's like GP1B, I want to say. Von Willebrand, we know with 8. Real girl, recurrent oral ulcers. I feel like that should give me something. The oral ulcers part and large platelets. I know that Bernard Soulier is large platelets. The only thing that's bothering me here is impaired in response to I can't say ristocetin. I've definitely seen that, but I just cannot remember that detail. Okay. Prolonged bleeding time, large platelets. I don't know if that's like the hot word. It's large.
Okay.
It might be. I cannot remember the other parts. Aggregation. Normal aggregation. Part of me wants to go with like Bernard Soulier. I know it's very rare to ask about that. And another part of me wants to go with von Willebrand. I'm pretty split on it. They ask about von Willebrand a good amount. ADP, collagen, and thrombin. Okay. I think that other key is that ristocetin, but I can't remember that detail about.
Okay. What'd your gut say here?
My gut says don't go away from von Willebrand, but I don't think that's it because
Okay.
I don't think that's it. It's not hitting some certain things. I would go with the Bernard Soulier,
Okay.
but I'm not confident on this one.
Yeah, that's the correct answer. Okay.
Okay.
So key things here is that it's big platelets. Okay, that's going to be a
Yes,
thing. I always remember BS for big sucker, right? That's
I
how.
remember because it's like Great Bernard, like one of those dogs, and they're huge, and that's fine.
Yeah. So they're going to be
Yeah.
big here. They're going to have issues with aggregating, but then if you add in ADP collagen thrombin, they'll aggregate correctly. Um,
Okay.
so that's going to be key here. The platelets, the platelet count should be relatively normal though, just so you know in general. Von Willebrand's, they're not going to talk about the size of the platelet, right? On one
Okay.
Willebrand's, right? The platelets should still be fine, right? In number and in characteristics, right? The issue with von Willebrand's is that you're going to have increased bleeding time, but you're going to also have increased like APTT, right? Because it's like I think it helps factor 8. And so if you have von Willebrand's disease, then factor 8 is not going to work as well either. So
Correct. That's what I think of always with that.
yeah, so definitely for sure, right? Glassman 2B, 3A, right? Kind of what you
Okay.
mentioned, right? Soulier is 1B, 9B, complex here. Von Willebrand's we talked about a little bit here, right? Hemophilia A is X-linked, so it's
Mm-hmm.
usually in
Boys.
males, right?
Mm-hmm.
And then it's factor 8 issue, right? Hemophilia B, right, is going to be factor
Factor
9,
9. Yep.
right? ITP, immune thrombus, cytopenic purpura, you're going to have low platelets. You might have some petechiae, but you're going to have an inciting event usually, right? So
So a
you
virus usually, right? Like
yep,
a
usually a
week
virus
ago or
before,
something.
a week or
Okay.
2 weeks before, and then you have like really decreased platelets. And
Okay.
so, and that's going to be a platelet count number, but everything else of the platelet should work, right? It's just you have
Okay.
less platelets, right? So the aggregation and adhesion should still work.